The views and opinions expressed on the Healthcare Advocate Show do not necessarily represent the views and opinions of Connoisseur Media or its advertisers. It's Revolution Healthcare, the show that keeps you in the know about the ever-changing healthcare system. We all need answers to our many questions about health and the revolution in healthcare, presented by Patient Advocate for you, making sure that your healthcare is coordinated properly. And now, here is Sharon Gauthier, taking your calls and sharing information. 1-888-574-2723. 1-888-574-2723.
Good morning, everybody. Welcome to Revolution Healthcare Radio Show. This week we don't have a guest, so you're going to be listening to me talk about care coordination, case management, what it is, what it isn't, and also accountable care organizations. Most people don't really understand what happened with Medicare a few years back, and I wanted to discuss today a little bit about what that means to you. And it was part of the Obamacare plan, but really it was initiated by Medicare looking at people being readmitted to the hospital. So for years, people with Medicare could go to the hospital with an issue, and if they were discharged, and sometimes they would be discharged too early, and they came back with the same problem, let's say a urinary tract infection or some kind of sepsis or other infection, if they, excuse me, they would come back with, the following week with the same issue. Medicare traditionally would just pay for that hospital visit. Medicare a few years back looked at that and said, wait a minute, why are we paying for the same kind of care for the same problem? And it was costing a lot of money for the government. Did the hospitals think that that was a problem before they identified it with Medicare? My sense is no. And the reason is that they were getting paid. So hospitals tend to not really look at an issue until it hits their pocketbook, which there's a lot of discussion going on right now, but some of the cuts going on in Connecticut regarding Medicaid, this is strictly Medicare. So Medicare, who are people who are over the age of 65, said, we are not going to pay you for that readmission. Now, it's not for every readmission that happens, because we all know that people have multi-system issues. And it may mean that somebody who has a urinary tract infection may not necessarily come back because of the urinary tract infection within 30 days. They may come back because of their congestive heart failure or their diabetes. And the government said, well, we're not going to ding you or penalize you for all the admissions, but it will be a percentage of admissions. And as Nora Duncan spoke about last week, there's quite a few hospitals in Connecticut that have been penalized because of these readmissions, because they're all struggling as to how they are going to be addressing readmissions and not have them come back. So consequently, what was developed were accountable care organizations. Now, I find it very interesting that we had to use the term accountable care organization regarding health care. You would assume that we would all be accountable for the care, but the reality is that nobody really was accountable. So what has happened through the last 10 years is that there has been a large buyout of physician practices as the cost of having a practice increased. Hospital organizations went to the practices and said to them, let us buy out your practice. If you become part of our team and part of our whole system, it will cost less because we'll be able to share the costs of it. And it all sounded like a great idea on paper. And so many practices have been bought out. I tried to find information about how many practices have been bought out in the state of Connecticut, and that doesn't seem to be something that's easily sought. But there's a large amount of physician practices out there that have been bought out by a hospital. So what's the downside of that? To me, excuse me. The downside of that to me has been the increase of patients that they've now been required to see. And when you saw your doctor years ago, like the doctor that I had when I was younger would actually come to your house, which is almost non-existent today, and see you when there was a problem. You'd get that penicillin injection when you had strep throat, and he'd go off his merry way and you would pay them cash. Today the practices are totally different. Few physician groups go to your home. There are a few concierge physicians that do that. And so you're left with having to get an appointment with the physician practices. Physician practices that are owned by a hospital are now required to have a certain amount of patients that they see every day. It could be that physician group was seeing 10 or 15 patients a day, and that was manageable. But now they're seeing 25 to 30 patients a day. There are actually some practices that see much more than that if there's more than one physician in the practice. But when you think about the dynamics of that and the logistics of that, and having run a physician practice in the past, I've seen what happens when someone comes in and they have a total of maybe 8 or 10 minutes to see from the desk to seeing the doctor. So what we're going to talk about is how hospital consolidation has increased healthcare costs, what has happened by employing physicians, and although it was promoted to reform efforts to seek reducing waste, and it was looked as a value instead of volume, what's actually happened is it has become volume-based, because now you have those practices that are mandated by the hospitals to see a certain amount of patients. And those of you who've been in a physician's practice, you know what that's like. When you enter, the first question they ask you is about your insurance card. You could have gone the week before, and they're still going to ask you for your insurance card. So the time from the front desk to discharge is perhaps 8 to 10 minutes. So now when you're looking at those practices also being mandated to coordinate your care, what does that really mean at the end of it? Do they have the time to really find out what's going on with you? Do they have the ability to really listen to what's going on? And what kind of staff do they have in physician practices, which to me is a major problem in a lot of practices, especially specialties. So when we come back, we're going to talk about hospital acquisitions and the reasons why they happened and what that means right now to physicians when you have accountable care down their backside, saying that now you have to be accountable for that person from the time they get discharged to the hospital, hoping that they won't come back. So today we're talking about case management, accountable care organizations, what that means to the patient. We're talking about physician practices, how they've changed in the last 5 or 6 years, and what that means to the patient and the family, and we'll hopefully get some phone calls.
Uh-oh, flu season again. Time to get a flu shot. You now have a choice in flu vaccines. You can ask for Flu Block. It's made with modern technology, while other flu vaccines use processes that date back to the 1950s. No actual flu virus is used to make Flu Block. The next time you get a flu shot, ask for Flu Block, the pure choice, because you have a choice in flu vaccines.
For over a decade, Home Helpers has been making life easier for those in need.
I was very impressed when we first met. So why don't you tell me a little bit about the reasons why you actually got into this?
For me, it's personal. I took care of my aging parents who wanted to stay at home. We actually had a good experience having a home health aide come in and give us respite to make it as comfortable as possible, keep them in control, keep them at home, which was very, very important to my family. And Home Helpers share that same vision. We picked Home Helpers because they're extremely strict about the quality of care, the training of the caregivers. They're very serious about putting someone in the home and making sure they're insured, bonded, and well qualified to take care of someone's loved one.
Are you looking for senior care for an aging parent or loved one? Are you a new mom or working parent who could use an extra hand? Let Home Helpers of Connecticut make your life easy. Get a free consultation that is tailored just for you. Call 860-698-2244 or find the nearest office at homehelpershomecare.com.
Welcome back, everybody. You're with, hang on, I'm trying to look things up online as we're talking. You are with Revolution Healthcare Radio. This is Sharon Gauthier. I'm a registered nurse and I owned a care management company. We're talking today about care coordination and accountable care organizations that few people know about even exist. We're looking at what an accountable care organization does and also the reason why it was developed in order to try and save money for those people who are Medicare. Medicare is the largest amount of money spent on our population right now, and Medicare was looking to find a way to be able to make our medical system accountable. And again, I find that interesting that we even have to use that term, because it seems to me that everybody should be accountable for what they do. But unfortunately, in healthcare, that isn't always the way. If you have any questions at all, or you'd like to call and tell us about your story, we'd be more than happy to hear you. Our number is 888-574-2723. That's 888-574-2723. So let's talk a little bit about what case management is. Case management was developed a number of years ago in order to help coordinate care when you were in the hospital. Most of the case managers many years ago were social workers, because most of the issues regarding going home was a social issue. As our population became older and there were more medical management issues, it transitioned over to registered nurses in hospitals with a good background in clinical to be able to coordinate care when people go out. For me as a case manager, which I was at Hartford Hospital for a number of years, it really was about length of stay. I felt that length of stay was the only thing that really was discussed. Length of stay was the only thing that I would get a pat on the back about, or they would be disgruntled about. So quarterly, we would get reports telling us what our length of stay would be for the patients on our unit. So they would kind of average it out. So let's say for one quarter, the length of stay of the patients on the unit I was on, which is a neurotrauma unit, a very complex unit. And there were two of us that shared patients from the ICU that transitioned over to the neurotrauma unit. So we were in charge of transitioning traumatic events, brain injuries, to acute care facilities like hospital special care or St. Francis's Mount Sinai. Or we would be in charge of sending people to subacute, which are your convalescent homes. There never seemed to me, and again, this is my opinion, that there was a lot of caring about what the story was for each of the patients. And what I would find is that these quarterly reports would show up, and let's say the length of stay for that quarter was 4.2 days. Yes, they'd break it down to that amount. And then the next quarter, it might be 5.6 days. And I would be asked for an explanation of that, or somehow sanctioned or spoken to about why that was. And I was always confused by that, because I understood that the length of stay meant more money. But at the end of the day, I also felt that asking the questions that they're all mandated to ask now, that I was asking back then, and this was over 10 years ago, were important. Because if we received a patient who had had a stroke, a TIA, which is transient ischemic attack, it's a small stroke, and everything usually is resolved within a couple of days after there's a large amount of testing done on them, they would be discharged out to home care. Nobody sat down and talked to the patients about what home meant. And I would sit down and have that conversation with them. And I remember a gentleman who was this little Italian man who lived down at the south end of Hartford. He was 82 years old, and asking him what home meant. And when he asked me what I meant, I said, well, who does the shopping? Who does the cooking? Who gets you to your doctor's appointments? Do you have enough money to pay for your doctor's appointments? And remember, this was 10 years ago when none of this was really going on. And what I found was that this was a gentleman with a very thick accent who had a wife at home who needed care. She had dementia. So he was the caregiver. He was the gentleman who drove and did the grocery shopping and did the cooking and did the caregiving of his wife. Now he was going home with a discharge paper telling him that he could not drive for 6 to 8 weeks until he saw his doctor, that the VNA was going to be visiting him, but they only visit until you're back to baseline, which is usually pretty quick when you have a TIA and you resolve. And his having to manage his doctor's appointments and his transportation. And I wondered why nobody was really looking at that, because they weren't. So keeping that man for an extra day, to me, made sense to be able to try and put those things together. Did it make sense to the hospital? Didn't make sense to the hospital at that time. But I've always been told I was ahead of my time in how I thought. And now looking back at how I would get into trouble sometimes, which I was always in trouble for multiple reasons, but into trouble sometimes for hanging on to that person because the length of stay would go up. We're now in a situation in our country that those questions should have been asked all along, and they never were. And again, hospitals were set up to deal with an issue. You go in with a problem, they fix the problem, and you leave, and the directions of what you do afterwards are pretty much left to you and your family. And that's what they've always done. We've evolved into a country of having families that are all over the country. We no longer have family units. We have people living longer. And now they're in a position that we have to mandate them to ask those questions, which was always really sad to me that we would have to tell them about caring, because to me, that's what caring was all about. So now the hospitals are required to make sure that people go out with that information. And if they need the help, that they actually coordinate that. And that's when the accountable care organizations came about. Case management, now being mostly nurses in the hospitals, are still responsible for length of stay. They're still responsible for utilization review. But that also creates a problem in timing for them. So when we come back, I want to talk to you a little bit more now about accountable care organizations, what that actually means, and the problems in our system that we have that they continue to try and struggle with working out to help patients and families when they leave. All of us out there have been in a position to have a family member or ourselves in the hospital and understand still what a challenge that is when you leave. The number here is 888-574-2723. When we come back, we'll continue our discussion.
For over a decade, Home Helpers has been making life easier for those in need.
What I was impressed with Home Helpers is their passion for what they're doing. We worked with them in the past, and we recommend them to our clients.
Are you looking for senior care for an aging parent or loved one? Are you a new mom or working parent who could use an extra hand? Let Home Helpers of Connecticut make your life easy. Get a free consultation that is tailored just for you. Call 860-698-2244 or find the nearest office at homehelpershomecare.com.
Uh-oh, flu season again. Time to get a flu shot. You now have a choice in flu vaccines. You can ask for Flu Block. It's made with modern technology, while other flu vaccines use processes that date back to the 1950s. No actual flu virus is used to make Flu Block. Flu Block protects against the flu. The next time you get a flu shot, ask for Flu Block, the pure choice, because you have a choice in flu vaccines.
Home Helpers is a franchise in Connecticut, and what I was impressed with Home Helpers is their passion for what they're doing. We worked with them in the past, and we recommend them to our clients.
Are you looking for senior care for an aging parent or loved one? Are you a new mom or working parent who could use an extra hand? Let Home Helpers of Connecticut make your life easy. Get a free consultation. Call 860-698-2244 or find the nearest office at homehelpershomecare.com.
Welcome back, everybody, to Revolution Healthcare Radio. You're listening to Sharon Gauthier. I'm a registered nurse. I own a care management company and patient advocate service. You can call us at 888-574-2723. So we're talking about care management, case management, lots of different names for it, and what an accountable care organization is. So an accountable care organization that was really developed probably back in 2011-12 And there certainly was funding available that everyone grabbed in order to help with the process, are a group of doctors and hospitals and other care providers who come together voluntarily to give coordinated high-quality care to their Medicare patients. So voluntary is kind of interesting to me because I don't think it was at all voluntary. They were mandated to do this in order to save themselves from being penalized, and it is a nonprofit organization that is in between the hospitals and the physicians. So what the accountable care organizations are supposed to be doing and are struggling to do, there are 17, I think, in the state of Connecticut. And in order to be an accountable care organization, you need to have a 5,000 population of Medicare patients or more in order to develop an accountable care organization. So because it's Medicare driven in terms of payment, we're going to take a question. We have a caller, Linda from Simsbury, before we go on. Good morning, Linda. How are you?
Hi, good morning. I have a question regarding talking about going home from the hospital. Could you give an explanation as to what visiting nurses actually do? And also, do you have a choice as to which visiting nurse agency you can have come visit you once you get home?
Well, those are interesting questions, and actually one of my pet peeves, along with a few others. You should have a choice of what home care agency you use. The unfortunate thing that has happened is that the accountable care organizations have bought up other organizations to be part of their group. And in doing so, what I feel has happened is that the hospital discharge planners are now being told that they should be referring those patients to their own visiting nurses organization. So, for instance, Hartford Hospital has VNA Healthcare, which is now VNA Home Care or Health at Home. I forget what they call it now. So if you go into Hartford Hospital and you don't tell them who you have, they will refer you automatically to their own agency. Now, they will deny the fact that they do this and say that patients are given a choice. And again, I challenge the fact that that actually happens because I've spoken on the side to case managers who are told that if they don't refer them, they're asked why they haven't referred them. So that's the first problem. The second problem is that if you go in there with a visiting nurse association group, that becomes a really big challenge to get that person back to the agency they were with. So in reality, they should be asking all the patients when they come in, are you involved with a visiting nurse group? And if they are, that referral should go back to them. But what I've heard from other visiting nurse organizations, and I work with all of them, and unfortunately it's a general term, so the case manager can go into the patient and say, well, your VNA is all set up, and the assumption from the patient is, oh, well, I'm going to get the same one that I got before. What I've heard from other organizations is this, that they've actually called the hospitals, all of them, I'm not picking on any particular one, and have said to the case managers, this patient is with us, and we want you to know that. And they still are not referred back to them. As a matter of fact, they've been not allowed to go in and actually see the patient that belongs to them. So I wrote an article on LinkedIn called Stealing Patients because I believe that that's what the system is doing, that they're stealing patients and they're doing it in a bullyish way that should not be done, that the option should be for the patient. And even if the hospital took 6 or 8 agencies and said, you know, these are the preferred agencies by doing some research or ask the questions, it would be a fairer ground than it is now. And it is one of my pet peeves because in talking to some of the other VNAs in Connecticut, they all feel that they're just going to be pushed out of business unless they're bought up by an accountable care organization. And I agree that that's what's going to happen, and we're going to be very limited as to what our options are. I think that each agency has their own specialty. There are some agencies that I will go to for wound care. There's others that I won't. There's some that have cardiac expertise. So again, it's a great question. And the other question you asked was, what do they do? So Medicare is not proactive. It's not a proactive health care insurance for the elderly. And the reason I say that is it's nothing that can be kicked in to utilize and be paid for by them unless there's a crisis or a need or a skill. So when something happens to someone and they go to the hospital, they fall, they have a fracture, they have an infection, they have the flu, Medicare pays for that visit going in, depending upon whatever your insurance is, whether it's a Medicare that is managed by another company or just regular Medicare, straight Medicare. But they will pay for that visit. You have the right to then have coverage when you go home, because then they say, well, we want nurses to go in and visit with you for a certain period of time, and the criteria is very clear as to what those needs are, and it has to be based on a skill that you might need. So you'll go home with a visiting nurse association that will come in and open you to services. So it's a registered nurse, and can only be a registered nurse that opens services to that patient and family. They will come in and they will assess what the need is for that particular patient. That probably is not the nurse who's going to be your care manager managing you from that point forward. It's going to be the nurse that just opens cases. They do the assessment and they make the decision, and it's an assessment, but it's also a referral from the hospital for physical therapy, occupational therapy, social work, whatever it is they may need. And then all those services are pulled into that patient and family, but not permanently. There is a part of it that also gives you an aide, a home health aide that comes in to shower you a couple times a week. So again, it's short term, 4 to 6 weeks, or whatever time it takes you to get back to baseline. Baseline doesn't mean that you don't still need help. Baseline means that if you are walking and talking and eating and maybe able to drive, that they're going to pull themselves out. They do want you to be homebound, which has been expanded, but it means that you can't go to the mall for the day or drive around the state and expect to get these services in your home. So hopefully that answered your question. And yes, Linda, you do have the ability to ask for what you want and have a choice, and also have time to research those choices.
Thank you very much, Sharon. Very informative show.
Thank you so much, Linda.
Bye-bye.
So that was Linda from Simsbury asking a great question. We're talking about accountable care organizations, and that kind of went right into some of the issues with accountable care. So accountable care organizations, I believe there's 17 in Connecticut. They have to have a population of 5,000 or more Medicare patients. And that organization is the go-between the hospitals and the physician groups. So what Medicare is saying is that when someone goes to the hospital with an event, what they are mandating now is that they want to make sure that those people in the hospital are well connected when they leave to go back to their physicians. Physicians should be managing their patients, not having a medical assistant in the office that is told to send everybody to the ER. And I spent a number of years in emergency medicine, and also as a manager for a short period of time at Hartford Hospital, and it's utilized as a window for physicians to say, we don't have appointments today, just go to the ER, which created a lot of problems in the ER. Now they really can't be saying that. But who are the people in the doctor's offices that are managing? So let's talk about that. The Accountable Care Organization is now the go-between, so they're saying to the physician groups, you pay us a certain amount of money, and we will take care of those patients when they leave the hospital to make sure they go back to you. So when we come back from our sponsorship, we'll talk a little bit about how that process works and how it doesn't work. Thank you for listening to Revolution Healthcare Radio.
Flu-Block. It's a breakthrough vaccine now available to protect against the spread of influenza. Protein Sciences Corporation in Meriden, Connecticut developed a revolutionary technology.
It is the healthy individuals that carry and spread the flu. Every year, about 30,000 Americans will die as a result of the complications of influenza.
That's one of the reasons why I had an interest in it, is that our population that our service tends to manage are elderly. People were having to get a booster with the flu vaccine. What I liked about Flu-Block is that the people last year in our group, the clients of ours that got the Flu-Block vaccine, did not get a booster, and they did not get the flu. And the people that didn't get the Flu-Block vaccine either got the flu in addition to getting the vaccine, or were told by their physicians that now we had to try to create a process for them to get a second vaccine.
Researchers at Protein Sciences created a novel vaccine with no eggs, no live virus or preservatives, essentially pure and natural.
For over a decade, Home Helpers has been making life easier for those in need.
What I was impressed with Home Helpers is their passion for what they're doing. We worked with them in the past, and we recommend them to our clients.
Are you looking for senior care for an aging parent or loved one? Are you a new mom or working parent who could use an extra hand? Let Home Helpers of Connecticut make your life easy. Get a free consultation that is tailored just for you. Call 860-698-2244 or find the nearest office at homehelpershomecare.com.
Back, everybody. You're listening to Revolution Healthcare Radio with Sharon Gauthier. You can call us at 888-574-2723. We have another caller. And I guess it's Elaine from Torrington?
Yes, that's right. Hi, how are you, Ms. Gauthier?
I'm good, Elaine. How are you? What's your question today?
Well, I guess kind of more a comment maybe. My mom has been ill, and I've been so frustrated making doctor's appointments for her. We needed to see a neurologist, and that was a 3-month wait for that appointment. And then more recently, we had to see rheumatology, and they were telling me they had no appointment until next June. It's so frustrating. I wondered if you had any comments or thoughts on this.
Well, I think that is a problem, and I think that those specialties are very difficult to get appointments in, whether you're referred to them or not. I've run into the same issue with geriatric psychiatric appointments, in that I have a gentleman that was transferred up here by his daughter into an assisted living, and he had psychiatric help down in Florida, and this was back in August, and could not get him an appointment to December. So it's like, what do you do in the meantime? I don't know what the answer is to that. I just know that it is a very large problem across the continuum, or lack of continuum, in our system, and then creates even a bigger issue, because if that person with the rheumatoid issue, which there are multiple problems with managing that and medication needs, the referral has come from a primary physician, then you're left with a primary physician hopefully trying to manage that. And is that the best way to manage it if that's not what their specialty? Is it being looked at? I think it is being looked at, but again, specialties have their own issues in terms of payment and as far as accessibility. I'm not sure how many physicians are going into specialties, how many are owned by by hospitals. And again, when you think about the fact that they're seeing probably 28 patients a day, if there is such a need, why would they not expand on that and have openings? I know just yesterday I had a discussion with a primary care physician about a gentleman that certainly needs to have a conservator and keeps going in and out of the ER, and there's nobody around with him, and I'm trying to help out. And we couldn't get him an appointment for 6 days for the physician to be able to see him. Now, this is his physician, and I'm assuming you're talking about the same thing. This is not a new patient, right?
No. In one case it was, but the rheumatologist, no, she is a patient at that practice, and they're saying next June is as soon as they can see her.
Yeah, that's totally unacceptable. And that's usually my comment when I call back, and why they love to talk to me when I do call the practices. Because I did say to this primary physician even, do you not have space somewhere for emergencies? So what's that going to create? This gentleman that I'm talking about, who's having a lot of problems with medication management and his dementia, is probably going to end up in the ER. And again, we're filling up our ERs, which is the most expensive way to get into our healthcare system. And the reason for that is we don't have availability anyplace else for these people to go. So I think it's a great question, but I don't have an answer. But I'm glad we were able to bring it forward again as an ongoing problem for everyone out there, in that, as there is a commercial out there that, from an unnamed hospital that says, just call us, and within 24 hours, we will get you an appointment with your primary physician and all the specialists around you. It makes me wonder, when I get calls like this, Why is that not happening? And it is a marketing tool. It's a way to get people to call. Then when they don't get those appointments, those people aren't going to say anything about it. And do the physician groups even know that this particular hospital is doing that? So great that you're out there advertising how wonderful you are, but back it up with how wonderful you might be. So good luck. I hope you do get an appointment sooner. What my suggestion would be is to call the practice manager, tell them the reason why that person needs a follow-up appointment, and also get into how unreasonable this is that an existing patient in October cannot get an appointment until June, that it's totally unacceptable. And I would just keep complaining about it. And then if that practice is owned by a hospital, I would find out who the key person is in that hospital, and I would call them and say, look, this is not acceptable, because that person's going to end up in the ER or with multiple admissions, and is that okay with them? So again, being the squeaky wheel, which I'm really good at, sometimes works, sometimes it bounces back at you and you're actually treated very poorly the next time you call because you've done that. But I think that the more we talk about it and the more we complain about it, maybe something will be done.
Yes, well, I really appreciate that, and it sounds to me like I'm going to need your services, so maybe I can leave my phone number with the radio personality there, okay?
That would be great. Christian would be happy to take that. Thank you, Elaine, for calling. And again, we are listening to Revolution Healthcare Radio. We are a radio show that's talking about the things that other people don't talk about, and I want to talk today about accountable care organizations. So accountable care organizations, as we were talking about, is this group of people, physicians, clinical people, licensed people, unlicensed people, that are supposed to be helping the hospitals, discharging people out so that they're connected to their physicians and helping them with what they need. So there is a very good effort going on right now, but again, my sense is that they're struggling because there still remains not to have one person in charge. And when one person is not in charge, then that's where things slip through the cracks. So you can be admitted, you can be educated, as we talked about last week with Nora Duncan, that there's a caregiver law that's in place now. That means that starting October 1st, the hospitals are mandated and required to speak to whoever the caregiver is that's been identified by the patient. Great idea. How they actually roll that out is a concern to me, because it may be that the day of discharge, they're just going to call and say they're being discharged. Do you have any questions? This is what needs to happen. And if you don't understand it, they'll ask you to come in at that time. And it's not necessarily planned out. Are there dedicated case managers in each of the units? I'm finding that they're not. So you often find that there are multiple discharge planners involved on multiple units. And you may talk to Judy one day, but talk to Susan the next. So we're going to take a break and come back to Revolution Healthcare Radio, talking about accountable care organizations. I was very impressed when we first met, and what I was impressed with Home Helpers is their passion for what they're doing. So why don't you tell me a little bit about the reasons why you actually got into this?
For me, it's personal. I took care of my aging parents who wanted to stay at home. Home Helpers share that same vision. We picked Home Helpers because they're extremely strict about the quality of care, the training of the caregivers. They're very serious about putting someone in the home and making sure they're insured, bonded, and well qualified to take care of someone's loved one.
Are you looking for senior care for an aging parent or loved one? Let Home Helpers of Connecticut make your life easy. Get a free consultation that is tailored just for you. Call 860-698-2244 or find the nearest office at homehelpershomecare.com.
You now have a choice in flu vaccines. You can ask for Flu Block. No actual flu virus is used to make Flu Block. No gluten, no latex, no eggs, no antibiotics, or no formaldehyde. Flu Block is proven to provide broad protection against multiple strains of the flu. The next time you get a flu shot, ask for Flu Block, the pure choice, because you have a choice in flu vaccines.
Coming soon, the Revolution Healthcare Podcast. The people who never talk and the stories that don't exist. The podcast is a more intimate, in-depth examination of the personal challenges caused by healthcare. The focus is on the human aspect of healthcare, from patients and families to doctors and nurses. They all have a story that needs to be heard. The Revolution Healthcare podcast is available early January 2016.
Good morning, everybody. You're listening to Revolution Healthcare Radio. We're talking about case management and accountable care organizations. I'm trying to find what the list is in Connecticut. If you go in and you Google accountable care organization, it is amazing what you end up getting. A really large list of a lot of people offering services to help hospitals. We have another caller. We have Ted from Bristol. Hi, Ted. How are you?
Yes, how are you today?
I'm very good, sir. How are you?
Oh, good, fine. Thank you very much. I had a question. My brother, we have a home care service that comes in every day, pretty much, unless he's my brother. I come at certain other days to help take care of him. But they come during the day, and just one person all the time, and he gets very good care. But it's pretty much babysitting for my brother who has frontal lobe dementia.
Correct.
In the evenings, he goes home when the homeowner comes in. He takes over and cares for my brother, and he gives him wonderful care also. And he ends up doing a lot more than the service does. And I was wondering, would he be able to get something from the state that would financially help him? And who would I call if this is possible?
That's a really good question, Ted. You're absolutely right. There is a program through Connecticut Community Care, and it is an assessment that they would be able to do. Look this up for you. The Newington Town Hall will have a social worker department. So if he calls the town hall in Newington, which I'm going to get you that number also, he can ask for the social work department. And the social work department will also be able to come out and connect him to services that are available through the state. There are a lot of home care programs. The state is looking at a more cost-effective way of managing people where you would be able to get some help with paying for someone privately. Just keep in mind that when you are paying for someone privately versus not privately, you are at risk for the liability of that person as an employee. Most people are happy to take that risk. Others may not. Others may know or may not know about it. But I would just caution you that the liability piece of it does go on the homeowner then if, for instance, that person got hurt or anything happened to the person they're caring for. So let me give you a couple of numbers, Ted. The first number is to CCCI. The number is 860-257-1573. And they never answer the phone. I don't know why, but they never do. I would leave a phone number. They will call you back, and then he tells them what the issues are, and they will connect you. They're mostly social workers. Actually, they're all social workers who will then make an appointment to come out and see him. The second number I would give is for the town of Newington. The town of Newington number is 860-665-8500. The town of Newington should have a social work department, and that social work department will be able to help him figure out what benefits that he may very well qualify for, and there are a lot of benefits out there. The other place I would suggest you go to is the Alzheimer's Association in Connecticut. The Alzheimer's Association Connecticut is a wonderful source for caregivers in particular. And if he can just go on their website, a phone number would kind of be fruitless to give you, but tell him to go on the Connecticut Alzheimer's Association website, and there is a boatload of information there with people with dementia. And frontal lobe dementia is probably the most difficult to manage. As his brother, I'm sure you're aware of that. A lot of behavior components come into that. And now, is he on Medicare?
Yes, he receives a disability check each month, which he paid in for years ago.
Okay.
He might have thought something was down the road that would be a health problem, because as a high school student, he had broken his neck, and didn't know if that would eventually have complications down the road. So he does get a check for, I'd say a little over $2,000 a month, and he also gets a check from Social Security for about the same.
So just understand that may impede the ability for him to access certain programs, but certainly not keep him away from certain programs. So, Ted, thank you very much for calling. We appreciate a very good question that you asked, and I appreciate the support that you give your brother through the years, and good luck to you, sir.
Thank you so much. As I said, he gets good care from the care service that comes in, and I was just looking for pretty much something for the homeowner who gives him wonderful care also.
Excellent. Yes, and that may, like I said, I think those resources we shared with you may be able to help him. And certainly, if it continues, have him call our office, which is 860-703-1575. And we'd be more than happy to also help him further access information.
All right, that's wonderful. Thank you so much.
You're welcome, Ted. Thank you for listening.
All right, thank you.
You're welcome. So that was Ted from Bristol asking a very valuable question. And again, we're talking about accountable care organizations, and we're talking about care management. So again, accountable care organizations are the conduit or the go-between the hospitals and the physicians' offices. So you leave the hospital. They are supposed to give you the information you need in order to connect back to your physician who should be managing your care. And the accountable care organizations are helping out with that in order to keep people from being readmitted to the hospital, because they will be penalized. At some point, everyone will be penalized, not just the hospitals. It will be the physician groups, and it will be the convalescent homes. So we're going to continue talking about this, and I want to talk a little bit about some of the problems with that when we come back after our sponsorship information is given to you.
Thank you for listening to Revolution Healthcare Radio. Want to learn more about the show? Visit revolutionhealthcareradio.com. You can also access old shows, learn more about our guests, and contact us with your questions.
Are you looking for senior care for an aging parent or loved one? Are you a new mom or working parent who could use an extra hand? Let Home Helpers of Connecticut make your life easy.
What I was impressed with Home Helpers is their passion for what they're doing. We worked with them in the past, and we recommend them to our clients.
For over a decade, Home Helpers has been making life easier for those in need.
Get a free consultation that is tailored just for you. Call 860-698-2244 or find the nearest office at homehelpershomecare.com.
Flu Block. It's a breakthrough vaccine now available to protect against the spread of influenza. Protein Sciences Corporation in Meriden, Connecticut developed a revolutionary technology.
It is the healthy individuals that carry and spread the flu. Every year, about 30,000 Americans will die as a result of the complications of influenza.
It's one of the reasons why I had an interest in it is that our population that our service tends to manage are elderly. People were having to get a booster with the flu vaccine. What I liked about Flu Block is that the people last year in our group, the clients of ours that got the Flu Block vaccine, did not get a booster, and they did not get the flu. And the people that didn't get the Flu Block vaccine either got the flu in addition to getting the vaccine, or were told by their physicians that now we had to try to create a process for them to get a second vaccine.
Researchers at Protein Sciences created a novel vaccine with no eggs, no live virus or preservatives, essentially pure and natural.
Welcome back, everybody, to Revolution Healthcare Radio. You're listening to Sharon Gauthier. I'm a registered nurse, and I have a private care management company and patient advocacy company. The number to call here is 888-574-2723. We have received some pretty interesting calls. I was able to pull up the number of accountable care organizations in Connecticut from the website that is a Connecticut website, the OLR Research Report. Office of Legislative Research. And if somebody wants to go to that, they can go to www.cga.ct.gov, and it will list who the accountable care organizations are. So some of your big hospitals, Hartford Healthcare, MPS is in Middletown, PriMed is in Shelton, Pro Health Physicians is a group, St. Francis Healthcare Partners. There's quite a few. I think there's more than these, but these are some of the big ones that we're talking about. And again, what I spoke to you about was that the accountable care organizations are being paid by the physicians who are part of it, that are now the go-between the hospital and the physicians, because the goal is to get people managed well when they leave the hospital. Talked a little bit about there is little consistency when it comes to who is on the unit for taking charge of the patients when they leave. What I often find, as my staff does, is there's multiple people who are involved and not a dedicated case manager. Not in all cases, but in many cases. And that creates a problem in terms of communication. So someone gets discharged out. We now have the CARE Act, which Nora Duncan spoke about last week, which means that they're now mandated to include whoever that caregiver is in the process of being discharged. That was effective October 1st, and that's also going to help with the process. So now hospitals are mandated to have the caregiver understand what the issues are and what the process is for that person being discharged. And now the onus will be on that caregiver. The problem with that is that, is there a language barrier? Are we asking the right questions? Is the caregiver just saying, yes, I understand, and not understanding? I think what Nora talked about is that this law that they were behind getting passed will reevaluate that in a certain time frame to see whether or not it's working. But it's a step towards trying to coordinate care better. So now a hospital that's part of the accountable care organization has staff there that will help with the process of making sure that the physicians are managing the care of that person. So that person goes home with the caregiver who is well versed on the issues. Medication management is a very big problem because when you are hospitalized, your medications are transitioned into whatever medications they happen to have in their group of meds. So Mrs. Smith may go in with a purple pill and it could be changed to a yellow pill, but it's still in the same family. And that creates a lot of confusion for people when they go home. What they're trying to do is just keep them with the same med list that they had before they left. But I've had experiences recently with a person that left the hospital with an old med list who was put in a taxi to go home, and they sent him to the old address that he lived at, which is a building that has been destroyed. And the gentleman was blind and has a 24-hour caregiver, and we were never called in order to tell us that he was even going home. So when the caregiver was waiting for him, and this was in the evening that we had set up because we knew he was going to come home at some time, and the discharge actually started at 9 in the morning, I was calling at the hospital multiple times asking where he was. Finally, by 6:30 at night when I called, sounded like a very young nurse. She was very proud of the fact that she put him in a cab. And I said, well, he's legally blind. Were you aware of that? Which she was not. So an hour and a half later, when we couldn't find him and we called back, what we found was that the wrong address he was sent to, which is a convalescent home that was closed down. And now he had missed his evening medication. He's an insulin-dependent diabetic. He was extremely upset, had a little bit of dementia. The med list that they sent was an old med list, so we actually were able to get him home by about 8:30 that night. But this was recent. So, even now I'm finding that discharges, especially for people who do not have family members maybe involved, who may be Medicaid and are in the hospital, that there's just this disconnect. So 3 different nurses that day, 3 different shifts, a resident putting together a discharge summary for him that was also incorrect on many levels, and thrown into a taxi at 5 or 6 o'clock at night, not knowing that he's blind, sent to the wrong address, creates a really big problem for everyone. So, we don't make up the stories, we just kind of share them, and it's a story that can happen everywhere. So you often wonder with this major hospital that does have an accountable care organization, that does have case managers, exactly what went wrong with this process. And we were identified from the beginning because we happen to have conservatorship of him as being the person in charge of his care. And yet we're not told of information about him. Sometimes they're resistant to tell us information, but just as an aside of what's now happening regardless of the accountable care organizations. Physicians' practices now mandated to manage people. What does that mean? Well, when practices have been bought out by hospitals and they're now mandated to see a number of patients, let's say they're seeing maybe 25 patients in a day, how much time does that give them? And these people are coming into their office, and is there ever an assessment of what's going on with them?